This is an example of an endoscopic endonasal approach for decompression of an optic nerve and orbital apex. This is an 18-year-old female who presents with worsening eye pain and headache, and she has proptosis and an APD. CT scan shows a significant bony lesion involving the anterior clinoid with compression of the optic canal. The nasal phase is initiated with a resection of the middle turbinate and a preservation of the pedicle for nasal septal flap. The superior aspect of the posterior septum is incised to allow for sphenoidotomy. In addition, a maxillary antrostomy is performed, and the completion of the posterior ethmoidectomy completes the exposure. Septations within the sphenoid are reduced to define the anatomy, and image guidance confirms localization of the optic canal and carotid artery. Next, a high-speed drill is used to first thin the bone over the orbital apex and then carefully dissect it free. This helps define the optic nerve deep to the thickened bone. The bone is then sequentially carefully thinned using copious irrigation on the drill continuously to avoid heating of the optic nerve. The bone is essentially blue-lined and then carefully peeled free from the nerve. Here you can see the abnormal bone that grows in the setting of fibrous dysplasia. The superior aspect of the optic canal, which is related to the medial anterior clinoid, is then carefully shelled and peeled away from the optic nerve. Inferiorly, the optic strut is drilled to allow 180 degrees of decompression. Again, superiorly, the nerve is decompressed all the way to the sphenoid limbus and extended into the medial aspect of the anterior clinoid using ultrasonic aspirator, the Sonopet. Here you see at the end greater than 180 degree decompression. A free mucosal graft from the middle turbinate on the ipsilateral side is placed over the area in the advent of any thinning of the dura, and this is merely covered with Surgicel and fibrin glue. Here the postoperative scan shows a complete medial decompression, and the final pathology confirmed fibrous dysplasia.